Trend questions are tricky, stressful, and brand new for many of you. And if you don't know how to approach them, they can cost you the exam. In this video, I'm going to show you exactly how to handle these trend questions. We'll go through real examples. I'll walk you through the correct answers, break down the explanations in simple terms, and share the top strategies that help students spot the right choice every time. All right, listen up. You're going to come across some NCLEX questions where they don't just give you a snapshot of what's happening, they show you how things are changing over time. These are called trend questions. Now, why do these matter? Because in real-life nursing, you don't just walk into a room, take one look at the vitals, and decide everything. You watch things hour by hour, shift by shift. That's what the test is simulating. So in these trend questions, you're expected to act like the nurse who's been on that unit all day, reading the chart, watching the monitors, noticing how the patient is slowly getting better or slowly getting worse. Example question. Let's talk through it. Let's walk through one together. You've got a post-op patient who had abdominal surgery this morning. Now it's 2 p.m. You look back at the vitals chart for the last 6 hours. Here's what you see. 8 a.m., temps 98.6, heart rate's 88, BP is 128.76, pain's a 4. 10 a.m., temps up to 99.4, heart rate's 96, BP dropped a little to 122.74, pain is 5. Noon, temps now 100.1, heart rate's 102, BP is 118.72, pain is 6. 2 p.m., temp is 101.2, heart rate's 110, BP is 110.68, pain still 6. All right, what do you hear? This patient's temperature is climbing, their heart rate is speeding up, and their blood pressure is slowly dropping. Now think, is this just pain? Pain's important, but it hasn't changed much. Is it internal bleeding? Doesn't really fit. We'd see a sharper BP drop and no fever. Could it be a PE? No, that would be sudden. But sepsis? Ding ding. That slow burning fever, the rising HR, the falling BP, that's sepsis developing. That's the power of trend questions. They're not about memorizing values. They're about reading the room before the room catches fire. Key skill. These questions test. They test whether you can spot a problem before it becomes a crisis, interpret patterns, not just numbers, make safe, clinical decisions using changing information. You're caring for a patient admitted with pneumonia. You review their vitals from this morning. At 6 a.m., temp is 99.1, HR is 90, respiratory rate is 18, BP is 124.78, and their oxygen saturation is 96%. By 8 a.m., temp has crept up to 99.8, HR is 96, and O2 sat dropped to 95%. At 10 a.m., temp is now 100.5, HR 104, RR 22, BP 144.74, and O2 sat is 93%. At 12 noon, temp hits 101.4, HR 112, RR 26, BP 106.70, and O2 sat is now just 90%. Now listen to those numbers again in your mind. Fever's rising, heart rate's up, respiration's climbing, blood pressure's slipping down, oxygen levels are falling. The question is, what's the priority nursing intervention? A, give an antipyretic. B, notify the provider. C, reassess in 30 minutes. D, encourage oral fluids. Just think it through. Pause me if you need time. Remember, I won't give the answer here. It's for practice. Final tip, when you see a table, don't panic. Just talk yourself through it out loud like a nurse would. Okay, heart rate's rising. Temp's creeping up. Blood pressure's dipping a little. O2 sat slipping. What's going on here? You don't need to memorize every lab. Just recognize when the body is quietly crashing.
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX-RN. I know how stressful it can be, especially when you're balancing everything, clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX-RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and most importantly, help you feel more ready. Good luck. You've got this.
Okay, imagine this. You're not just any nurse walking into a room for the first time. You're the nurse who's been on this patient all shift. You know what they were like in the morning, after lunch, and now here in the afternoon. That's what trend questions on the NCLEX are testing. They're not about spotting one abnormal value. They're about noticing how things are changing over time. You'll often get vitals, lab values, or mental status that evolves across hours or even days. And they want to know, can you connect the dots between what's happening now and where this patient is likely heading? Because in real nursing, complications don't always shout. Sometimes they whisper over time. And trend questions want to know, are you listening? What exactly is a trend question? Let's break it down clearly. It gives you a series of values or progressive observations, usually vitals, lab results, or symptoms over time. It won't usually tell you this is bad. Instead, you'll see things evolve slowly, and you have to read between the lines to catch the problem before it explodes. Why are they important? Because anyone can look at a BP of 70/40 and say, uh-oh. But a great nurse sees it dropping from 118 to 106 to 94 and says, we need to act before this becomes an emergency. This is pattern recognition, and it's the heart of trend questions. What they usually ask. They might say things like, what complication is this patient developing? Which action is most appropriate based on the trend? Which finding is of greatest concern? Your answer must come from interpreting the entire timeline, not just a single value. Let's walk through a full, different example. Picture this patient, Mrs. Thompson, 82 years old, admitted for congestive heart failure exacerbation. It's your second shift with her, and you're reviewing her progress. Here's what you remember. She was a little short of breath, but could talk in full sentences. Respiratory rate was 20. O2 saturation 95% on 2L nasal cannula. BP was 138/82. HR was 88. She had mild pedal edema, and she said her chest felt a little tight. You gave her scheduled furosemide. She said she felt lighter. Respiratory rate still 20. O2 sat 94%. BP 130/78. HR 92. She voided 400 milliliters of urine. Good diuresis. So far, so good, right? Now she's lying still, says she's a little tired. Respiration's up to 24. O2 sat dropped to 92%. You increased to 3 Elder nasal cannula. 122/74. 98. No new edema, but she says her chest is heavy again. Are you starting to get a little concerned? Now she's more short of breath, speaking in short phrases. Respiratory rate is 30. O2 sat is 89%, even on 3L nasal cannula. BP, 114/70, 106. You auscultate crackles that weren't there before. She's more pale and anxious. So now you're asked, based on this trend, which condition is this patient most likely developing? A, dehydration. B, pulmonary embolism. C, recurrent fluid overload. D, normal response to diuresis. Let's walk it through. First, what are the key changes? Her respiratory rate is climbing from 20, 24, 30. Oxygen saturation is dropping, even as oxygen is increased. Her HR is rising, and BP is slowly trending downward. She went from talking normally, short phrases, anxious and pale, and now crackles in lungs. So what's the trend here? This is pointing straight toward reaccumulating fluid in the lungs, likely due to CHF not resolving or possibly rebounding. The correct answer is C, recurrent fluid overload. Takeaway lessons. These questions are about timing and progression. You're not looking for a crisis yet. You're seeing a situation building up. And remember, the most dangerous thing is failing to act until it's too late. These questions want to know, can you spot danger before it spirals? Tips for tackling trend questions. Ask, where is this going? Not just, what is this now? Don't focus only on one vital sign. Look at the full picture. Consider whether the trend is getting better, worse, or plateauing. Always watch for changes in oxygenation, mental status, blood pressure, and perfusion. Those are the big red flags. Practice trend question. Here's your turn. A 56-year-old patient with newly diagnosed diabetes is being monitored after receiving insulin therapy. 8 a.m., blood glucose is 310 milligram, HR 88, BP 132/84, patient is alert. 10 a.m., glucose is 180 milligrams per deciliters, HR 92, BP 128/78, patient says they feel a bit lightheaded. 12 p.m., glucose is 90 milligrams per deciliter, HR 98, BP 120/76, patient looks pale and says they feel shaky. 3 p.m., glucose is 62 milligrams deciliter, HR 106, BP 110/72, patient is confused and sweating. What is the priority? A, administer glucagon. B, recheck blood glucose in 30 minutes. C, notify the provider. D, encourage oral fluid intake. Pause here and think. Again, no explanation provided. This is your practice.